PEG is an acronym for percutaneous, through the skin, endoscopic, via an endoscope, gastrostomy, to the stomach. It is a procedure typically performed by a gastroenterologist, general or upper GI surgeon, or radiologist, and is a simple and safe way to receive food or fluid for people who are unable to independently manage sufficient oral intake. This may be due to medical conditions or surgical interventions. It can also be invaluable at supplementing oral intake. There are 4 main types of feeding tubes: initial placement, balloon replacement, low profile, and jejunal tubes. Nurses are valuable team members in ensuring the PEG procedure is thoroughly explained and understood. Ideally, this can be from a dedicated PEG nurse, but gastroenterology and ward nurses also are invaluable at initiating and reinforcing education as opportunities arise. As the patient has been fasting in accordance with local recommendations, IV fluids are recommended to prevent dehydration and also provide IV access for the procedure. As the patient will need to fast for a period of time post-procedure, the IV access will remain in place and therefore must be reliable. Once the patient has been adequately sedated, a gastroscope is inserted into the mouth and gently manoeuvred into the esophagus, stomach and duodenum. Following diagnostic examination of the upper GI tract to exclude any outlet obstruction or disease, the stomach is distended with air. If significant disease is present, this may well contraindicate the PEG insertion. Information regarding the type and size of the gastrostomy tube must be recorded in the patient's notes and PEG book, as this will be highly valuable when the tube requires changing. The process of percutaneous endoscopic gastrostomy tube insertion has proved to be a safe way of inserting a feeding tube for patients requiring such assistance over a longer period of time. PEG feeding tubes are made of silicone, which is chemically inert and designed not to provoke a foreign body response. It does, however, perish over a period of time, which does differ with each individual. Perishing of the tube will cause the tube lumen to appear to have food particles attached, which cannot be flushed away. The smooth feeling of the exterior tube walls will also feel uneven when fingers are run along its length. Trauma can be intentional or unintentional. Intentional trauma can be caused by the patient if the patient is cognitively impaired. Unintentional trauma can occur by a number of means, such as the tube being caught accidentally in bed rails or pulled accidentally during rough play, usually seen in children. Removal of this form of PEG should be done by experienced medical officers or expert nursing staff. Gather the necessary equipment as per unit policy or protocol. Once the old tube is removed, discard gloves and rewash hands thoroughly. Clean the skin with the appropriate skin preparation solution. Test the new PEG tube for balloon integrity and functioning of external bolster and caps. The balloon may be tested by inflating it with the required volume of water.